On behalf of the primary healthcare team, I wish to extend sympathies to those who have lost their loved ones and properties, and to emphasize with all fellow Dominicans following the passage of Tropical Storm Erika. This evening, I'm going to focus on the essential components of primary healthcare services. As it relates to health centers, at present, most of our health centers are fully operational. Presently, the Dalis and Dominica health centers are not accessible via public transportation. However, there is a resident nurse in Dalis and a health team, including a doctor, who is being airlifted to provide services to those communities. The Bells Health Center, on the other hand, is not accessible and no healthcare services are being provided there at this time. Healthcare services for Esprit is now being provided for at the Roman Catholic Church Presbytery. As it relates to medication, persons suffering from non-communicable diseases such as diabetes, high blood pressure, and asthma should visit their healthcare center that is closest to them in the event of any emergencies. We encourage you to take your medication as was prescribed by your doctor. If your medication is finished, lost, or got wet during the storm, please report to the health center that is closest to you for a refill. Persons on insulin are all advised to keep your insulin in a cool area. It can remain at room temperature or in a cooler with ice if possible. As it relates to medical supplies in large quantities have been and continue to be distributed to all health districts via different mediums, by land, air, and sea. As it relates to shelters, presently there are about 6 shelters open to accommodate persons who have been evacuated from their homes. The shelter housing the most persons is at the Dominica Grammar School. Due to its close proximity to the Roseau Health Center, much of the needs of persons are being cared for there. However, nurses have set up a health post at the Dominica Grammar School where medical and counseling services are being provided for by the team. Plans are underway to expand these services. As a measure of preventative measures, so to speak, as it relates to water, until further notice, all drinking water should be boiled or treated using water purification tablets. And the environmental health arm of the Ministry of Health is now distributing these tablets. For persons who can see, this is an example of our water purification tablets. This is Aqua Tabs. Each packet contains about 11, I think, about 11 tablets. So as a mode of preparation, there are 11, 2, 4, 6, 8, 10 tablets. So as a mode of preparation, we're asking that you take 1 tablet and add it to 1 liter of water. 1 tablet to 1 liter of water. Now I have my bottle here with me. This is half a liter. So if I want to purify this water to make it drinkable, to 2 bottles of this, I would have to add 1 tablet. So 1 liter equals 1 tablet. Now, as it relates to this, everybody's wondering what I'm doing with this big bag. This is a bleach bottle, or I think we call it, well, it's a gallon bottle. We normally call it, there's a term we use. Jerry can, that's right. And it has a 4 liter capacity. So essentially what you do, you put 4 tablets into this container, you leave it stand for 30 minutes, and then it's ready to drink. All right, in addition to that, we want to avoid purchasing local juices if you are unsure of the quality of the water that is being used to prepare those juices. In order to prevent the breeding of mosquitoes, you are to store your water in clean, covered containers. This will help prevent diseases such as dengue and chikungunya. As it relates to hand washing, in areas that still do not have water, or where your sewage have been affected, attention must be paid to proper disposal of human waste, followed by hand washing. Hand washing is absolutely necessary at this time. In the absence of running water, please avoid washing your hands in basins. Rather, pour water onto your hands for washing. In the absence of water, you can use hand sanitizers. However, please remember that hand washing with soap and water is more effective than using hand sanitizers. As it relates to garbage disposal, please avoid littering and careless dumping of garbage to prevent vector-borne diseases such as leptospirosis and gastroenteritis that is caused by flies, rats, and other rodents. As it relates to dust, we recognize that there is a lot of dust in the affected communities. Please use a face mask when traveling through dusty areas. In the absence of a face mask, you can use a wet handkerchief. However, avoid dusty areas as much as possible. Please note that special attention must be placed on our most vulnerable populations, including our children, pregnant females, and the elderly, ensuring that their health is not compromised. So in summary, these are the take-home messages or the key points. Number 1, ensure your drinking water is safe. 2, that your hands are kept clean. 3, ensure proper human waste and garbage disposal. And 4, that your health services are available in all communities. The Ministry of Health has set up a hotline that you can call at any time for information or if you have questions. This number is 448-2151. Again, the number is 448-2151. At this time, we are indeed faced with challenges in one form or another in all districts around the island, but we are resolute in the fact that we will recover. Remember, you cannot be careless. Your health is your responsibility. Thank you.